Welcome back to the Build Beyond podcast. I'm your host, Chris Netley. The purpose of the Build Beyond podcast is to challenge and guide you so that you can reach your full potential. I want to talk about pain and rest today. This is fitting because I'm going through a pretty intense episode of low back pain right now. Depending on when you're listening to this, it might not be right now. As I'm recording this, I'm about 4 days into some pretty intense low back pain, but I think I'm on the downslope of it. I've actually had some notes on this podcast episode for a while. I've been toying around with it, and it just seems like a good time to record this. Let's rewind back to when I was first thinking about this. I was in yoga. I was zoning out as I do in yoga, and it kind of occurred to me. I mean, we know. I mean, it occurred to me. I've thought about this before, but everybody knows that physical activity and exercise is good for them. I feel like if you went out and you asked 100 people, 99 to 100 of them are going to say yes. Exercise and physical activity are good, and they're essential for health. We know the benefits of exercise and general physical activity. So increasing your physical activity can boost your mood. It can it can improve your sleep. It can lower your risk for things like heart disease and cancer, certain kinds of cancer, type 2 diabetes. It can lower your risk for Alzheimer's and dementia. It can affect your immune system, so it can speed up the recovery from different illnesses. It can lessen the symptoms when you do get sick. It boosts your energy. All around just makes your life better. So that's all. Again, that's all common knowledge. I don't think anyone would argue with any of that. The interesting thing is that if you look at the cost of physical activity and the cost of exercise, it's essentially free, right? Push-ups are free, walking's free, taking a knee and doing a lunge is free. You don't really have to pay to move. So you have all of these benefits. You have this thing that is essential to health, and beyond just maintaining a nice baseline of health, if you put in the time and the effort and you move regularly, you get to reduce your risk for all of the scary things, and you get to boost your immune system and your energy levels and improve your mood and improve your sleep. And on top of all of that, it's free. Think about that. I mean, if you're thinking of just like healthcare, and some form of healthcare is offering all of these benefits, and it's of no cost to you, and you don't have to go anywhere to do it, it almost seems unreal. And so I'm in yoga. We're going through some flow. I'm completely zoned out. And it's just occurred to me that I was in there with maybe 4 or 5 people, and like, I don't know, I just had this moment where I was like, oh, this is some really good healthcare. And that's maybe a weird thing to think about in a yoga studio or in a gym. But in that moment, we were all decreasing our risk for heart disease, diabetes, some kinds of cancer, Alzheimer's, dementia. We were improving our sleep, improving our mood. We were boosting our immune system. We were doing all of these things that you would associate with really good quality healthcare. But it was in a yoga studio, and we were moving, and it just as easily could have been a gym, or it could have been on a walk, or maybe a bike ride with your kids. It doesn't matter. It's just the movement piece. And then I think it's interesting because when I say it now, it so obviously is beneficial and is healthcare. But if you just saw it and we weren't having this conversation and you took it out of context, you wouldn't think healthcare. You would think fitness or physical activity. But if I say, okay, picture healthcare, you're not going to picture a yoga studio, or right now, like I'm sitting at a CrossFit gym. If you're not watching this, if you're just listening to it, you're not going to think about those things. What you're going to think about when I say picture healthcare, you're going to think about parking your car, walking into some blandly painted waiting room with some old chairs, and you go up to a counter and you sign in and you check in, and then, you know what I mean? Like this stereotypical healthcare experience. But and I'm not discounting that, because there's a lot of benefit that comes from that. Obviously, if you have a viral infection and you need to go get help, you're going to go to a medical doctor, and they're going to have a clinic like that. So I don't want to, not putting that down, but I just think it's interesting because that is, when we think of healthcare, that's what we picture. And yet I just had this kind of, I would say it was an epiphany doing when I was in yoga, but it's not really like that profound. It just kind of, I thought it was interesting at like 6:30 a.m. The 4 or 5 of us that were there were engaging in healthcare, but it was physical fitness. It was yoga. So I had that thought, and then I started to think about another topic that has come up. It actually came up on my last podcast recording with AJ, a PT who I was talking to, and we got on the topic of rest. It's very common when someone has pain or they get injured to be told to rest. And I think that it's well-meaning, and there's a lot of benefit to rest. Sometimes you just got to take a beat. You pause take a day off, take a couple days off, maybe a week. A short period can be really, really beneficial. And maybe even you get back to the gym quickly, but you rest that joint. So let's say your elbow is bugging you, but you want to get back in the gym. So you do squats, that's something that doesn't affect the elbow, or you go on a run, or you do something to rest the joint while you still stay physically active. So I'm not here to talk trash about rest, but I'm going to give you my observation. I get people who come to me. It's very common, and this happens, I want to say, sometimes weekly, if not monthly. Someone's had some type of pain or injury, or something's been going on for a while. A long time ago, someone told them they should rest, and now it's a decade or two later, and they're still resting. They're still not doing what they want to do, and they've almost embodied this concept of, I need to rest this joint, or I need to rest this muscle, or I can't do certain things. And I think it's really interesting. And I don't think that I don't think that the recommendations are, I think they're given with good intent, I guess is what I'm trying to say. So I'm not trying to suggest that that doctors or chiropractors or PTs or anyone out there who recommends rest is trying to hurt someone, but it's an interesting thought if you think about it. So we know that increasing physical activity has all of these benefits, right? And we know that the absence of physical activity, being sedentary, not only deletes all of those crazy benefits, but it takes you below a health standard and makes you more susceptible to a lot of these chronic diseases that, quite frankly, freak people out. I mean, think about it. Heart disease. I think it's the number one killer now of men and women. If not, it's up there. Nobody likes heart disease. Nobody wants cancer. Nobody wants dementia. Nobody wants Alzheimer's. No one wants diabetes. That's 5 right there that we know increasing physical activity can help reduce your risk. So if someone has, let's say, a meniscus problem in their knee, just in one knee, and they get recommended prolonged rest, we are going to increase their risk for all of these 5 diseases, plus affect their immune system, plus affect their mood, plus affect their sleep negatively because of knee pain. It just doesn't make, when you think about it this way, it just doesn't make any sense. Especially prolonged rest is really what I'm talking about. So right now, why I want to bring this back to why I thought this was a good time to talk about it is because I'm going through a pretty noteworthy episode of low back pain right now. Day 4, I'd say my pain levels, they get up to 6 to 7 out of 10. But I feel like everything in my mind and my body is telling me to rest. And I think that's probably why it's, when people get this advice, they go with it. They run with it. I guess that's not, they don't run, they stop running with it. But they go with this advice because it feels so natural. It feels so good to rest. I can find a very comfortable position lying down on my back. I can just watch Netflix all day. I can take off work. But if you do that for too long, and you let the pain affect your life that way, ultimately we are going down the path, or we are at least walking in the direction of the path of disability. Because if you don't use it, you lose it. And that is kind of cliche, but it tends to be true with physical capabilities. For example, we were all, or most of us were born with the ability to squat deep in a very comfortable position, watch a toddler squat. And we lose that. But there are certain cultures that they never lose it because they use it constantly. So I think there's some wisdom to that silly little rhyme. But I guess what I'm trying to say is that, with my low back pain, if I decide to rest for a prolonged period of time, I not only there's not only a health risk to it just beyond pain, but I'm not really working. I'm basically like calming down the pain and just trying to like huddle into this pain-free zone. And I think what happens with a lot of people is there's this idea, and it's very natural, that when you're in pain, if you push into the pain, you are making something worse. You are worsening your injury. And that can be true. So if you've got back pain and you think you actually broke your back, like there's actual fracture of the spine, you want to figure that out. And if you did, there's going to be some rest and probably some bracing to it. But in the absence of trauma or some type of severe pathology like an infection or cancer or something crazy like that, which is really like a small percentage of the people who would come to see someone like me, you're not going to injure it worse. You could piss it off and you could make the pain worse, but for the most part, you're not going to cause more tissue damage. I think for me, and I've shared this before on other videos, I didn't come up with this analogy, but it works it really fits for me. When I have low back pain, it's like a fire alarm that's going off when there's no fire. It's like something like steam from the shower affects the fire alarm. It's almost like this unnatural amount of pain and tension. And I know that it's going to last for a certain period of time, but in this scenario, I can't go buy a new fire alarm because the fire alarm is my central nervous system. But I can desensitize it, and I can desensitize it with movements and positions and kind of leaning into pain. And I have a toolbox for that. Luckily, I do this professionally, so I have a lot of tools. But that's kind of what I do clinically. I teach people how to develop their own toolbox. It's not that I don't crack backs. I do sometimes. It's actually quite rare. It's more and more rare. It's a nice way to take the edge off especially if someone's had a positive experience with it before. But for the most part, I just see it as like a manual Advil. There's some short-term benefit to it. It's not risk-free. It's very low risk, but it's definitely not risk-free getting adjusted. So I want people to understand the risks and the limitations, and that the potential benefits are just, it is kind of like taking an Advil or something like that. And I don't think that's minimizing it, and I don't think that's putting it down. I think it's just being real. I think I'm just being honest with you. So I use manual therapy techniques. I do, especially for people who have had positive experiences with them before. But those are just to take the edge off. They're a means to an end to get people moving more and more. And so the concept is no rest. How can we get you through this episode of pain with the least amount of rest possible? And if we have to rest a specific joint and we have to rest specific activities, can we increase physical activity in other ways? For example, I have probably tripled my step count since I've had low back pain. It's something that feels good on my back, or at least it doesn't feel bad, and it's something I know that I can do. So I'm not lifting heavy. I'm not doing explosive movements. I'm not doing a lot of the stuff I'd like to be doing, but I'm doing something, and I'm doing a lot more walking. And there's positive health benefits to that. So I am continuing to move, and I'm continuing to work on things. And so I think the idea of prolonged rest after an injury or prolonged rest with pain is interesting, because for a lot of people, it's like, okay, you have 7 out of 10 pain right now. and you want to be able to do this, this, and this, and you'd like to be able to do those things today, and you feel like that you need to drop your pain to a certain level. So I would ask them, maybe they label their pain at 7 out of 10. Let's just use low back pain as an example. And then they say, well, I really would like to be able to put on my shoes, and it won't be pain free, but put it on without, having a back spasm. Okay, well, that we can work on that. And then I need to be able to walk up and down stairs carrying a laundry basket. Okay, we can work on that. So I would have my patient give me the specific activities and the specific tasks and the pain levels that they will accept. And then clinically, or in the gym, I guess is where my clinic is, we just work on those things. So I try and get the pain level down quickly. We try and do that through movement and the minimal amount of manual therapy, so at minimum effective dose, and we try and work back. So in no way, shape, or form does my treatment plan ever involve rest unless I'm worried about something, unless I don't know. So for example, not too long ago, I had an athlete with a suspected shoulder dislocation. I wasn't there when it happened. Based on the physical exam, when I look at like all the different things it could be, I could not rule out instability. I couldn't rule out a very specific type of fracture that can happen with a shoulder dislocation. So the history in the exam, it didn't come out the way we had hoped. And so for in that specific case, I said, hey, I think you need some imaging. We can rule this out with imaging. And if the imaging is clear and we're not seeing the signs of instability, we're not seeing this fracture, there's no tears in anything, and it's just pain, we will find a way to work through that. But I'm not going to just find a way to work through a fracture. So as I said, there are some specific instances where I think rest is not only appropriate, it's essential. But it usually has to do with some type of trauma, like I said, or an infection or some type of other pathology or something we don't understand. So we do a history and exam, and I'm like, I don't know. I don't have a lot of confidence in this. We might recommend rest for a brief period until we figure something out. And that's usually with a co-management option. And I do have one more thing to add. Pain and injury is an opportunity. There is a saying, and I think Kelly Starrett said it. I don't know if he created it, but I think I heard him say it, that pain is a request for change. So your one opportunity is your body might be telling you, hey, something needs to change. Maybe you need to sleep more. Maybe your nutrition's not where it needs to be. Maybe you're very stressed out. Maybe your recovery is poor. Maybe your training program needs work. Maybe you don't have a training program and you need to work more. Maybe you need a higher skill level for whatever you're trying to do. Your body might be telling you that something needs to improve and something needs to change. So that's an opportunity. Another opportunity is to get better at something else. And this is an approach we use for athletes, or I like to use for athletes. So if someone's got a torn ACL and we've got a while to work back after ACL surgery, well, how good are they at pull-ups? Is there an upper body component, or is there any benefit to having more upper body strength for their sport? Let's work on that. We can still work on cardio. There are a lot of different ways we can jack someone's heart rate up without putting stress on that knee. And you can look at it with any injury. It's like, okay, well, what else could we do? What are some skills within your sport that you could practice with your good leg or with your arms or with any other body part that isn't injured? So you actually give the athlete license to get better at activities that will help them when they return to sport, or you give them a license to improve on activities of the sport. So there are a lot of different options. And I think if you look at pain and injury as an opportunity and you see multiple opportunities, my body's telling me I should change. What do I need to change? How do I prevent this? Or how do I reduce the likelihood of this in the future? Boom, good opportunity. Okay, as I'm working back through this, I have more opportunities here. What am I really bad at, or what could I improve that doesn't have anything to do with this injury? Because I'm going to have more time and energy on my hands. Maybe I should work on this or that. So you can just look for all of the opportunities that come along with the injury. Plus, working back from an injury psychologically, I think you can go in different directions. You can be defeated and you can let that injury define you. A lot of people, they identify with their injury. So this is this is the type of person. I'm sorry if I'm describing you, because I know people aren't. It shouldn't be funny, but there is the type of person who carries their imaging on their phone and likes to show it to me. I like looking at imaging. I think it is helpful. I always feel bad for that person because it's usually like, look at the shape of my spine or look at the joint angle here. And 99% of the time, it's not really that big of a deal, but someone made it a big deal to them, and it is a big deal to them psychologically. And it's like this weight they're carrying around on their back because they have access to it. They look at it on their phone. So you can go in different directions with it. You can look at the injury and be like, oh, this is going to define me, or this is not going to define me. I'm going to come back stronger. I think a good example of that was Kobe Bryant when he tore his Achilles late in his career. You know, it was an opportunity. It was an opportunity to do what a lot of people couldn't do. Even young athletes have trouble coming back from that injury, but someone at his age, you know, it was a huge challenge and he saw it as a big opportunity and he was successful with it. So those are my thoughts on resting when you're injured or resting when you're in pain. Definitely different opinions on it. I try and avoid it myself personally, and I try and have my patients avoid it. I want to keep people as active as possible because it helps reduce the disability with the specific injury, and it helps with general overall health. Psychologically, it helps. And all in all, movement just makes your life better. Being physically active and physically capable makes your life better. And we don't want to let pain and injury affect that. And there is a lot that people can do. They just need some guidance. And that's why the whole theme behind Build Beyond, whether it's the Build Beyond podcast, which you're listening to, or it's Build Beyond Health, which is my clinic, Build Beyond as a brand, as an entity, it exists. I mean, the purpose of it is to challenge and guide so that people can reach their full potential. And I think that's the role that I like to play as a healthcare provider. I like to challenge people because I think a lot of times, especially in the rehab world, it's not challenging enough. It starts off great, but it doesn't progress. It's not hard enough. And then people need that guidance. They need a coach. It's like they need a pain Sherpa. They've got to have someone walk with them and guide them along the path. And ultimately, people just want to reach their full potential, whether it's an athlete trying to reach a high level, or it's just, you know, a regular person like me who's got a couple kids and a job and I just trying to maximize my full potential as a dad. This weekend, my son's birthday, we are going camping together, just the two of us, sleeping on the ground in a tent with some pretty severe low back pain. So for me this weekend to reach my full potential, I've got to show up and I've got to perform so that he has a good birthday, you know, and I can't let low back pain just dictate my son's happiness. I mean, it's being a little dramatic, I know, but it's just the way I think about it. All right. I hope this was helpful. Thank you for listening. And I've got some pretty exciting episodes coming up that we will be recording within the next few weeks and the next few months. So stay tuned.